This is astrocytoma. It's very difficult to cure. This patient had had chemotherapy, and he had been told he had a couple of months to live. The first slides are from before our treatment. The white spot here in the middle, that's cancer. This is the next section down in the brain, and the next, and the next, and the next. And you can see it's invading most of the left hemisphere. CT scans are reversed. What looks like the right to you is actually the patient's left side. You can see there it's filled up a substantial part of the brain. That's all the way down to the eye sockets. We treated this patient. 3 months later, he had scans, and this is what he looked like afterwards. These little white spots are what's called spiculation. When cancer dies, it leaves behind calcium. Next scan down, again, calcium deposits, no active cancer. Next one down, and down to the eyes. So what happened to this patient? Well, his symptoms got better. He was originally unable to walk unassisted. After treatment, he could walk. He still had to hold his hands out for balance sometimes, but he was able to walk. He was originally having difficulty talking. After treatment, his speech recovered, and he went in to see the oncologist. The oncologist wanted him dead for a simple reason. He had already told him he was going to die. He didn't like having me come in and save a patient. For one thing, that costs the hospital money, and it costs the palliative care money. So the doctor went to this patient. He called the patient in with his wife and his brother. And according to them, I saw them an hour later, they're still crying, and they said that he shouted at them for 2 hours, saying, "You're a stage 4 terminal cancer patient. You are going to die. You are going to die. Nothing can save you. You're a stage 4 cancer patient. You are terminal. You are going to be dead very shortly. Nothing can save you." He did this for 2 hours until he completely broke their spirit. The scan showed that the tumor was gone, but the doctor wanted him dead. So he just told him repeatedly, "You're going to die," and he completely broke his spirit. This man went home crying. He laid down on his bed and he never got up. He stopped eating, he stopped drinking, and within 2 or 3 days he stopped breathing because he was told that he was going to. That was his only choice. I know this sounds incredible, but the fact is I had already treated 35 patients that I had taken away from the hospital. That cost them $35 million. They also weren't going to get the palliative care income, which is about $250,000 per patient. So that cost the palliative care $7.5 million. They wanted me stopped. So the head of oncology went to every hospital and told them to tell all of their doctors if they had anything to do with me, they would lose their admitting rights. Then they went to palliative care and told them, if you tell any patients about PDT, when we find out about it, you will lose your job and we'll see to it that you never work again in palliative care or as a nurse. I know, that's incredible. It's hard to believe, but that's what happened. The point is, can this be treated? Yes, it can be treated. Can we guarantee that we can stop it in all cases? No, but This was 5 years ago, and we've made substantial improvements to our technology. We're using more powerful equipment. We're using a number of additives, mostly natural, and we've improved our response rate substantially. Next, I'm going to show you a video from a patient who came to us with brain cancer in the Philippines. This patient was treated in Australia.